Group. Welcome to today's event. We are talking about digital health insurance, innovative paths for prevention and care. We are today touching different points, and there will be a keynote speak by Peter Stockhammer, that is Managing Director at Generali Vitality, and there will be also a round table of three important protagonists of the industry: Adriano de Matteis, Managing Director at RGA; Emanuele Costa, Partner and Director for P&C Insurance at BCG, Boston Consulting Group; and of course, Peter Ohnemus, President and CEO of Decadu. So first of all, welcome to everybody. And for the audience, I would like to inform you that due to the fact that we are still waiting for Peter Stockhammer to enter due to technical problems, this is the beauty of live events. Most probably we will invert the agenda and we start with the roundtable. So that actually I would be very pleased to give you an introduction of what we are talking today. So in general, we are facing a very exciting times. What we call insurtech today is a complex phenomenon that is changing, transforming, and evolving our insurance industry. Different factors are happening. First of all, the digital customer is rising. We have new ecosystems that are basically coming up. New distribution channels, players that are not insurance who are entering into the distribution industries, new technologies that are facilitating different products, evolving a new kind of offer and creating new opportunities. But all these has an impact on the value chain, impact on the organizational model, impact on the investment plans. One of the areas that is more affected by these trends in the positive, negative way, that means opportunity and need of investment, is the offer, the market offer. So incumbents and protagonists of the industry need to fine-tune their offer strategy and bring to the market a new kind of proposition. On the other hand, new players in this marketplace can enter with a flexible, say, digital offer and get new market share. So the offer is central to compete in this new scenario. When we talk about offer, there are different kinds of ecosystems that are shaping. There is the offer related to retail, corporate, and different industries are being transformed. Connected insurance regarding the motor industry, connected home, and of course, health. And this is exactly the topic of today, digital health, but how the new offer is shaping and how the market is able to be transformed and I would say optimized based on new consumer needs. Digital platform business. Digital health today will be transformed in a pure platform business where insurance, services, assistance, and consumer needs are fully integrated. That is modular, that is convenient, that is affordable for different target groups. So here we can immediately raise a series of questions. Is the industry ready to satisfy this new platform business approach? Are the insurers today ready to satisfy this new business approach? How the consumer is evolving? Is the consumer himself ready? And which are the drivers of his purchase behavior and which are their real needs? And of course, who really will be the new protagonist of this new value chain? The current players will be new players. It will be an integrated model. how collaboration between different players will evolve and will make the difference. And for sure, how us as protagonists of this industry, associations, the insurtech, incumbent consulting firms could support this transformation and how can facilitate it. This is exactly the discussion that we immediately faces in the panel with the three important protagonists that I'm very honored to host and happy to introduce. Once again, we start with the round table, as I anticipated, waiting for the Peter joining, but I'm very happy to introduce Adriano de Matteis, Managing Director of RGA, Emanuele Costa, Partner and Director of PC Insurance of BCG, and Peter Ohnemus, President and CEO of Decadu. So first of all, good afternoon, guys, and welcome to the event.
Good afternoon.
It's really a pleasure.
Thank you for inviting us.
Yeah, thank you so much. It's really a pleasure. So I will start from Peter. So Peter, thank you so much to be with us. And actually, we are really from an Italian Tech Association supporting Decadu in terms of growth. And you guys are doing an excellent work, not only from an operational standpoint, but also from an educational one. So thank you so much. Peter, predict and prevent strategy is growing in terms of awareness, and we are really very often talking about that. What is exactly this in concrete? How this is evolving? What we are really talking about?
So I think the most important fact is the health insurance as we know it today is about 150 years old. It was invented by Otto von Bismarck, who couldn't get anyone to work for the German government. So he basically made physically a wooden box and put the money in there. And that's why it was originally in German called the health box. If we now roll forward 150 years, and nothing much has changed in health insurance. So basically, health insurance receives capital and pays out capital. If you compare it a bit with an air conditioning system, it's like a valve, so the air conditioning valve gives you cold air or hot air. And I personally have been programming for the insurance industry over the last plus 30 years. And I think what is very much needed and what is coming now is this predict and prevent strategy, as we call it at Decadu. So why do I need to predict? Because in today's world, if we look at COVID, 90% of all the people that unfortunately passed away, they had one or multiple chronic diseases. So the topic number one for any health insurance operator should be my monthly cost of maintaining chronic diseases. Number two is that when we look at the overall industry, we are lacking 4.2 million doctors globally. We are lacking over 10 million nurses. So we need to build a new healthcare system where we are getting more at home and more in a digital way. So first we need to predict. How do we predict? By analyzing data and understanding what will happen. So if you drive your car today, it will say in your car, you need to go to service. Why couldn't we have the same prediction on human health? So basically what we are getting at is IoT is getting very cheap, Internet of devices, or those kind of Apple Watch, Fitbit, Garmin, electronic blood pressure devices, etc. So data will become ubiquitous in this prediction mirror. And the prevention, today we have very powerful tools such as machine learning, deep learning, or AI. So if we are capable, which we are today, with a risk or a health score to predict what will happen, we can actually prevent. And there was a very famous professor that about 200 years ago said, whatever you understand, you can improve. And the problem is, over the last 500 years, we invested massively into our healthcare system, just, to add the medical touch. But we never actually really looked at how could I improve the quality of human life. I gave a speech about 3 weeks ago at the 13th Global Health Insurance Conference, and there was a gentleman from AXA in France speaking, and he said, which I found really, really sad, that about 20 years of our life, we will live with one or multiple chronic diseases. So we need to find a way to understand, to prevent, and to improve the quality of life. And for me, that insurance operator that has the predict and prevent strategy will be more profitable, will have more happy clients, and will overall add to the quality of life of the consumer. So this is not a dream anymore, it's real life. And today with Dakadu, we service 35 of the top 100 health insurers around the world, and they are very clearly following this predict and prevent strategy.
Thank you, Peter. Adriano, if you look at prevention and care in general, and if you look at the new value chain, like insurance tech companies, technology, doctors, and insurance, in your opinion, are insurers late in this process, or they are aligned with the go-to-market?
Yeah, thank you, Simone, for the invitation to attend this conference. Yes, my greetings to all that is following us. My opinion comes from experience, and so as we know, on the prevention side and on the chronic management side, as Peter was saying, there are many digital engagement tools. They can help you monitor or track your blood pressure, your heart rate. They can push you with notifications to remind you to take your medicine, or they can use camera and algorithms to actually, as Peter was saying, to predict and prevent and help you manage even chronic condition. But then when it comes to insurance, I have a colleague in the UK, and he's suffering from diabetes, type 1 diabetes. And in 2018, he started to use a famous app, Freestyle Libre. I think everybody now knows about this app. And he was monitoring his insulin glucose and what he was eating and the exercise he was doing through this app that he finds fantastic. But still, when he went to his doctor didn't really rely on those data, but prefer him to have a finger prick and then read the results of the finger prick. By the way, you can have so many during a day while the app is continuous. So that's already significant. Now he's telling me that his doctor, after 3 years, is actually looking at those data because they are so good. But still, doctor comes second. So first the user, then the medicine, the doctor. Third, the insurance company doesn't know how to take those data, doesn't know what to do to those data. There are no products that can actually use those data and structure them into a product or a service. So far, as my colleague is telling me. So yes, my answer is that insurance is a little bit late when compared to other entities, but I'm happy to see that the first adopter are actually those that do have conditions in this case, and they when they find something useful, they use it. So it's our duty to find something useful and that can actually bring, as Peter was saying, improve human life, and then people would use it. So a little bit behind so far, Simone. That's my short answer.
Thank you, Adriano. Very, very interesting, and I agree with your point of view, and definitely it's a sensible point. Emanuele, from your perspective, strategic perspective, I would say, how do you see the evolution of the health system, health insurance industry in these last years, as in general? what are really the main drivers for change? Is this a technology element, or there is much more than that?
Thank you, and thank you everybody for participating. So I'll start maybe with a broader perspective on the health system, and then maybe we get to insurance. So on the health system, first of all, I mean, I do think and I do believe that the Italian national health system has a lot of merits and pockets of excellence. So I don't want to start, just complaining from the very beginning. No, I think we have a robust and fair and equitable system. Yet, obviously, we well know all the challenges that the health system, the national health system was facing even before COVID. I think that the most relevant issues were clearly underinvestment. So we lost 10% of GPs over the last years. Hospital beds reduced by 40% in the past decades. I do believe that we dismantled a lot the proximity medicine and proximity structures, relying too much on hospital care, and that brought a toll, especially when it comes to prevention, to personalization of care, and especially to chronic disease management, which some of my colleagues alluded to before. So that we started from challenges. COVID, of course, exacerbated those challenges. But I'm also positive about some of the implications that are resulting out of the pandemic. First of all, digital adoptions and changing customer behaviors, and also a very significant amount of public investments that will flow into the system and ideally transform the system. We're talking about 16 billion from the PNRR, and plus additional investments on digitization and research that could also benefit. So I think we will assist to reverting back to proximity medicine, proximity care. So increased investments on this area. I also think that we will assist to new treatment patterns, more hybrid, so to say. So with a mix of in-person, physical and remote digital treatments. I do also see a shift towards home care and home delivery. I mean, not only home delivery of medicines, but I've heard some startups in Italy that, for example, provide X-rays at home with a remote connection to doctors that can provide their assessment, even not being physically there. So a lot of innovation that I think it's coming. I do believe so. I want to be positive on the evolution of the health system, and I also think that we will see a significant evolution both on the provider side. Working as BCG, we work a lot also with investors like private equity funds, and the level of attention and interest on Italian providers, diagnostic laboratories, outpatients, diagnostic centers is quite amazing. There is a lot of competition to really create national champions in those areas, and also for insurers on products. But I would also extend this reflection to the overall operating model. And we talk with a lot of them in terms of integrating and extending the coverage of the value chain. So I think we will see a lot more of vertical integration with providers, medical providers, but we will also see a stronger and increased collaboration with new startups and new innovative companies that can provide a lot of value add to the traditional offering.
Thanks a lot, Emanuele. Really, the first round of questions was really interesting. Different point of view, a strategic consultancy, one of the leading European insurance company, and a reinsurance standpoint that can understand well how the insurance groups are behaving. Said that, in the meanwhile, Peter Stockhammer joined, so we are happy that we will be able to provide this keynote, but we will move to the second round of questions. Then I will leave the word to Peter Stockhammer, and then we will close again with the final round of questions. Said that, let's move to the second round. Peter, against you, Peter Ohnemus from Negli. How do you think it can be really feasible that insurance groups could become an integrated platform economy? So is this happening? You very often mention this, Peter Ohnemus.
Yeah. So when you look at the global, health insurance industry, it is definitely happening. I know we heard before that has been, savings taking place in Italy on the healthcare sector, and that actually pushes, in my eyes, even more for the integrated insurance operator. If we look in America, we have seen companies such as CVS, which is the third largest health retailer, acquiring Aetna. Aetna was the third largest health insurance company. So why do I mention this? Because I do believe that the health insurance industry and the provider industry will get closer to each other. So when we look at what's going on in different markets, the health insurance operators that are the integrated operators, they want to become the digital switchboard. So at Dagadu, we call this the digital health switchboard. So you basically have these microservices, as we heard before. They could be telemedicine, they could be mental well-being, they could be blood testing at home, etc. So the most expensive that we know in the healthcare sector globally, as I mentioned before, are chronic diseases. And second, of course, the emergency rooms. So we basically want to keep people out of hospital, and we want to keep people away from the emergency room from a cost perspective and from a sustainability perspective of the digital integrated insurance operator. We interviewed last year 380 different life and health insurance companies around the world. We published a paper on the integrated insurance operator, which gained a lot of recognition. And there we looked at where is the health insurance operator coming from and where are they going to. And we believe that we will see a serious consolidation between the payer and provider market. This will help drive down cost containment. We know today that the integrated insurance operator can take out 30% of the overall costs by driving forward the integrated insurance operator approach. So I don't think it's a matter about if the health insurance operator wants it or likes it. I think it's a matter about survival. And as you know, I'm always direct. It's swim or sink. So basically, either you become an integrated insurance operator and have everything in real time and have the predict and prevent strategy, or you will get serious trouble with your cost analysis and prediction going forward.
Thank you, Peter. Definitely is an opportunity, but also a major risk to not adapt quickly to the new environment. Adriano, from your point of view, from an insurance standpoint, where do you see the real major evolution in the health platforms, especially in terms of offer and positioning?
Yes, it's. I was looking also at the questions from. I read the first one. Maybe I can integrate in my answer.
Sure.
Yeah, it's the second. I didn't have the time to read the second one just arrived. Yeah, so the first thing with platforms, that the first question that we asked ourselves is, who are the users of those platforms? So, and when we see clearly two major type of users. So the first one is those that already have a chronic condition, as we have said earlier, or those that have a super health, so that are very, very healthy or healthier than the general population. If we look, for example, at Road to Health, one of our two platforms that we use in the UK, we see that on average the users are having 7,000 steps on average per day, whereas the typical or the average UK person will have half of them. So we already know that they are more active than the general population. So this already gives a little bit of selection and on who is using those platforms. A few words on the other platforms we use, Heidi, and here I answer the question. This is our major project that we have been starting this year. We will continue to develop in the future. We have found that the most useful feature that people really use and appreciate is the steerage or triage. The digital triage is very helpful for a lot of people, and the steerage or triage can steer patient to health information, to a pharmacy, to a nurse care, or a general practitioner visit, or specialist, or even accident and emergency. It can also steer to telemedicine, and I think this Emanuele was referring to this as well. So be cured at home. By the way, we have seen an acceleration of this service during COVID period, and I confirm from direct experience what Emanuele was saying earlier. And I also confirm that for us, the success is a combination of digital and physical. Absolutely. So when you combine digital and physical, you can create a framework that is really reliable, that is vetted, as we say, and that you can use. Another thing, and it's the last one, I think it's very important. We believe it's important. We have seen that it's important for the user of platforms is the education and information about, for example, lifestyle. So both Heidi and Quelth, the platform that we use for Road to Health, have content related to improving lifestyle. And we go back to the improvement of our lifestyle, as Peter was mentioning in the beginning. That is to say, how to quit smoking, or healthy recipes, but still tasty. Content, medical content is validated by, for example, Mayo Clinic or the National Health Care System, rather than Google search that can offer good advice, but also bad advice, or you don't know who is giving this advice, or if it's been validated, or if it's just an impression or an opinion, and so on. We need to remember that the goal of all this is to create engagement as much as possible. So people that come to a trusted source of content that they can rely to for anything that happens to their health and their lifestyle and the improvements they want to make. This is my answer on that question, Simone.
Yeah, very, very clear and very, very interesting. Thank you so much. Emanuele, let's stick to the customers that Adriano was mentioning. How customer needs, in your opinion, have been evolving in the last 5 or 10 years? How deep is the impact of COVID, and which additional changes are expected?
I think I want to let's start from the impact of COVID. I think one thing that we tend to forget is that beyond the direct casualties attributed to the virus, the impact of COVID was devastating on the Italian health. Also, indirectly. What I mean is that for the first time in recent history, life expectancy declined in Italy by about 1 year now for the overall average population. We've seen, first of all, a sharp reduction in terms of prevention visits. We have seen minus 50% in terms of planned surgeries. So terrible impact, for example, on oncologic patients. We've seen a number of other factors such as increasing obesity. We've seen increased use of alcohol. We've seen a surge in mental illness. So there is a lot of negative second order effects that we need to cope with. So I'm quite worried about what will emerge as the overall impact of the pandemic. Having said that, I would probably highlight three elements for me that will shape a little bit how the consumer behavior will change in the future. The first thing is for sure a higher attention to personal well-being and health, and also a demand for new services. Thinking about, for example, swab tests. Think about a lot of OTC products for hygiene, self and home hygiene, that where we see an incredible increase in demand over the past months. That's the first thing. And for sure, on this increase of attention, and insurance companies can certainly make advantage of it in terms of proposition. The second element is, and we were alluding to that before, new health consumption models. For sure, digital, remote, like we have from our customer survey, we see a doubling in terms of both interest and usage of telemedicine. Adriano mentioned that before, but we also see more, predisposition to self-care. The third element, and again, Adriano, you mentioned this, and I think it's important. We also see a higher attention in terms of transparency and what we would call empowered patient. I think, for example, I like a lot the transparency that the Piano Nazionale Esiti has created on medical outcomes from the hospitals. We've seen also some digital providers that make this transparency accessible to customers. So there's another element for me that is patients will be more and more interested in determining their treatment path and selecting also providers of care based on quality of outcomes. Again, to me, this is an incredible opportunity for insurance companies to support this guidance and direct their customers to the best treatment, which is often a challenge in the Italian health system.
Okay, thank you so much, Emanuele. Definitely very, very interesting. Fine. So I will move to the keynote speaker of Peter Stockhammer, and then after the speech, I will come back to our important panelists that are definitely sharing a relevant point of view that are very helpful to all of us. So I would ask to Peter Stockhammer. Welcome, Peter.
Buonasera Simone, buonasera a tutti.
Buonasera a te. So I remember to again the agenda to all of us, Peter Stockhammer, Managing Director of Generali Vitality GmbH. We are very pleased to have Peter with us, and we really ask to our panelists to remain with us because there will be the last round of questions after Peter Stockhammer speech. Please, Peter.
So firstly, I apologize that I'm late. Then the second, apologize that I do not my speech in Italian.
No problem. I think we understand you.
Yeah, and I will share my screen, and please let me know when it's there.
Yeah.
Perfect. So what I will tell you is, firstly, when we're speaking...
We don't see the screen, eh? We still don't see the screen.
See the screen?
Share the screen. You can
A lot of technical...
The icon condividi. It's coming.
Can you see it now?
Yeah, we can see.
And it's moving. Perfect. Okay. The interesting discussion that I had, and I will speak a little bit about, firstly, how I see the world and how see I this prevention topic. So firstly, when we're looking at current times, I think three things that are happening. Firstly, the nature of risk, which we introduce. And secondly, the improvement of technology. And thirdly, who we are as people and in the world, which will. So coming to the nature of risk. So coming from the UK, there is a model developed that is called the 4-4-60 model. What does this model say? We as human beings have 4 typical behaviors, meaning we're doing not enough sports, we're eating too much junk food, we're smoking, and have a too high alcohol intake. These 4 behaviors lead to 4 chronic diseases, which are lung diseases, diabetes, various types of cancer, and all the cardiovascular diseases. And these 4 chronic diseases stands for 60% of the deaths worldwide. Italy, even more, 70%, which is in all Western European countries. And interesting on that is, when you're looking in the absolute terms, our behavior have killed more people than both world wars and all the pandemics. Even if we're seeing, and I will not underestimate this, the pandemic that we're currently facing, where too many people died and still dying. But on top, we have to take into account we ourselves a risk to ourselves due to our behavior. What you're seeing here also when we're talking about, we're seeing here comparison of European countries, how old the people are getting, split in female and male, and the years we're spending healthy. And you're seeing that the span of life that we're living healthy is obviously shorter. Also a trend that is decreasing in each country, especially in Europe, which is some kind of wealthy statement. When you're looking at Italy, it's not so bad compared to other countries. So when I'm looking at Austria, which is here at the bottom of the slide, where it's really coming from. And when I'm presenting this internationally, I'm always saying people will live longer, healthier if they're following the Italian lifestyle, meaning not eating so much fat, using olive oil, using more fish, mozzarella, this what we're calling in Austria, Germany, the Italian lifestyle. So when I deep dive on the Italian situation, overall, 8 of 10 Italians living this healthy lifestyle. When you're looking at the younger population, only 2 out of 10 from the Italians living this healthy lifestyle. And I remember when Starbucks announced that they will start in Italy, and I remember when they started with this in this historical post office on the Piazza Cortusio in Milan, because it's nearby the former Generali office, how much consensus were and said they will never conquer this market because Italy is by definition an Italian market. But I'm not so sure if they're not approaching the younger people because it's some kind of lifestyle. You have the Wi-Fi for free and something like that. So we'll see how this will be the trend and is well decreasing like in other European countries. Let's talk about technology. We can talk a lot about technology and all the features that exist. IA and augmented reality, what's in. But I see it from a customer perspective. And there was a survey done, and people were simply asked, I cannot imagine a world without. And they can then tick on a list. And on this list, 43% said, I cannot imagine a world without my current partner. 84 say without the internet, and 97 without my smartphone. We have to take into account our smartphone is to us more important than the person we're spending our life to. And this shows also how technology influenced our daily life, how people using apps and the smartphone to track themselves, to self-optimize themselves, counting steps, counting heart rates, weights with smart scales, etc., etc. So that shows that this technique is yearly used by everyone. And who we are is on top, what you're seeing, and I'm speaking also from a corporate responsibility. In the past, our corporates were built because simply there was someone, a tailor, someone ran a bakery, and then we moved in a stage where we went to stock exchange markets, and more and more when you get financed externally, people asking which responsibility you take. As insurer, we have also some kind of social responsibility towards our customers, but also to the entire environment. And all this lead us to the opportunity to create some new type of insurance, to taking all this into account and smoothing or adding on to the protection topic, also the prevention topic. And to give you a short, brief overview, what does this mean and what we are doing as Generali Vitality. So simply what we're seeing here is how customers usually see what insurers offer from a product. So they're looking totally identical. There is not so easy to create a unique selling proposition. And what Generali Vitality is simply to, and we motivate you to live healthier. This is in a 3 steps approach. So we're asking you to follow us in 3 steps, which we call it know your health, improve your health, and enjoy the rewards. Simply with know your health, you get status online and with external medical tests. What is your current status that you are? That finally gives you some kind of vitality age, as we call it, and usually it's higher than your biological age, especially in Western Europe. As mentioned, people have this unhealthy behavior. By improving your health, we're simply then motivating people to live a healthier lifestyle, meaning doing more sports activity, getting a better nutrition, quit smoking, doing steps, this usual 10,000 steps. And with that, you're collecting points and we reward you for that. And the more you engage in the program, your healthier living, the higher and deeper will be the rewards. As mentioned, for the customers to give a motivation and some kind of push, and we're using simply this nudging approach that you see in several short nudge, as it now called, a hint in the right direction. You're collecting points. It's easy to use. We're using this in a digital way, meaning via an app and a web portal. You're collecting points, getting your status, and then you will be rewarded with vouchers or discounts and cashbacks from famous brands that you're having in. So like Amazon, Expedia, Garmin, Adidas, and Zalando, where can then free shopping. Obviously, to keep the people on the long run motivated and keeping them towards the healthy direction, it's important that you're not doing this once a year, so permanently, as this product is linked usually to an insurance solution. And we want on the long run that the people are staying healthy. And on top, what we are doing as well, we're giving our customers weekly and monthly activity goals. And if they reach them, they're getting rewarded. Or they can earn an Apple Watch for free over a period of 24 months. Important piece when we see this is that we're seeing that people are engaged. We're seeing that people taking to the self-optimization more care of themselves. Interesting for us because we are operating in several markets in Europe and faced then last year when the pandemic hit us with this full power and we faced the first lockdowns, that we were permanently communicating to the customers, enforcing them and giving them hints to stay healthy even if they're in home, could not leave their apartments for only for a short distance, and saw that the engagement was, due to our communication, even increasing. And our member base was thankful that we're giving all these hints how you can stay healthy. Because what we're seeing as well, and this is one of the downsides that we're having, I came recently a number of the effects of working from home and all these lockdowns, but especially working from home. And I would say you can call it working from home or plus 6.4 kilo. That's the average that Europeans have grown in the lockdowns, as it is really close to get some snacks that potentially not the healthiest. What I'm seeing here, and this is my conclusion, is, and this will be the question, you will see that customers more and more in this trend to optimize themselves, taking care of themselves, are going more in a prevention direction. And if we deliver them value, they will appreciate it and will follow us. Happy to take any questions.
Peter, thank you so much. I have a question for you. Do you see the Generali vitality model effectively working from a potential standpoint all over the globe? Or do you see this more applicable to very evolved markets? Or, I mean, how do you see this shift in the future?
So, yes, so when we're talking, other people are ready for that.
Yeah.
For sure, not 100%, obviously, but you have in each country, enough people are ready. Clearly, as we're working up from a European perspective, you see different understanding what people think what healthier lifestyle is. To give an example, Germany was one and saying staying healthy is doing a lot of sport. Looking at Italy, people saying, oh, I'm taking care of my nutrition. It's also an important thing. But you're seeing that people want to stay healthy. And seeing as well as a trend, man, is that more and more people taking care of their body shape. And this is a trend, and otherwise, tell me someone who is not using a smartphone, or how many people using fitness trackers.
Very clear, very clear. Great. So, Peter, I would ask you to stay with us. We will now move to the final question with our panelists that most probably will also have the opportunity to comment your keynote, and then we'll accept some questions from the audience. So I shift again to our panelists. So thanks a lot, Emanuele, Peter, and Adriano to be with us. Peter, you said in the past, Peter Ohnemus of Dakadu, of course. You said in the past you see digital health development, especially in a microservices perspective. Can you elaborate a bit about that?
Yes, we had a good talk also before we started the panel today, just behind the stage. And as I mentioned, you know, I've always been very close with Italy, as my brother is married with an Italian. And in Italy, you do actually have, in my eyes, an excellent, you know, public healthcare system. And those people are trying to do their best. And when you think about COVID, I think they showed how much they were willing to commit to their life. Going forward, I think it's going to be microservices based. So governments cannot keep on just providing health, you know, for free or as part of the tax system or whatever you want to call it, because the cost as we move in with the baby boomers would simply be too high. So as we move forward, we will see some kind of government-based, you know, healthcare services in many countries across Europe. And then on top of that, we will have the microservices. So what do we understand under microservices? They could be assisted living, they could be a cancer policy, they could be a diabetes policy, etc., etc. So when we look at insurance today, It's either black and white, it's, you know, silo-based, and you have your preferred, non-preferred lives, and that's what actuaries do. But your life is very different. So Simone's life is not Peter's life, and Adriano's life is not the life of Emanuele. So at the end of the day, we need more personalized insurance products. This granularity of data and microservices can only happen if we have the data. So as we move forward, data will become ubiquitous. It will come automatically out of Internet of Things devices, and those Internet of Things devices will go automatically into the underwriting system. So when we look at today with our risk engine, which is based on 300 million man-years of clinical data, where we do real-time underwriting and pay as you live, you can take out between 25 to 30% of the overall cost in the back office of issuing insurance products and maintaining those products. This is substantial. You see from Cigna, which is one of the largest health insurance operators in the world, they published a study with The Economist, and they are one of our platform clients, that they said, depending on how you do it, you can take out 4, you know, so you have basically 4 times return on every dollar that you invest. So you have an ROI of 4 up to 16, and this is a public study you can find on the internet. So yes, microservices is the future. It will become a lot more client and consumer driven, and it will make that you get a lot closer to the consumer's life. So I do believe that microservices is the future. I do believe that the digital health insurance switchboard, where you have services on off, is of extreme importance. Let me give you an example. Last year with COVID, United Healthcare Group is based on Dakadu for everything outside North America. You suddenly saw 30 to 40% increase in mental well-being services. So you need to be able to add these services immediately. And I don't need to tell you, when somebody is depressed or having mental issues, they're not going to wait 2-3 years to get that service. So it becomes a real-time based economy. The services from the insurance company becomes mission critical. And when you become mission critical, the consumer appreciates your service. So I think everybody wins in that equation.
Thank you, Peter. Thank you so much. Adriano, we have seen in Vitality from the presentation of Peter Stockhammer how the engagement is crucial for digital health. How do you see customer engagement evolving after COVID?
Yes, it's the presentation. It was very, very interesting. Thank you very much, Peter. And yes, for sure, risk score, healthy age, wearables, all those tools can create engagement. But we have seen that this is particularly true for already healthy people. That is to say, when it comes to change behavior in order to become healthy, it's not as easy as we would like to believe. And especially in the case of prevention, we have seen that low engagement in general has prevented people to actually make a breakthrough into a healthier lifestyle. We have seen an increase, as Peter was referring to, an increase during COVID. That's something that we experienced as well. But our data don't confirm, or is not yet confirming, to be precise, that this will be a long-term effect. We have seen in some cases doubling. The engagement has doubled, but it was more of a spike rather than something that is still continuing now. Right rewards, I think Peter has talked about rewards. Absolutely, right rewards also for us is crucial, and here to come to the concept of tailor-made or micro, even rewards has to be really tailor-made, because not everybody wants a cup of coffee or a mozzarella or a bottle of olive oil. Somebody may want this. Somebody may want some sport gear because they want to move rather than to eat something. And we have seen that the more those rewards are tied to the engagement itself of the app or the insurance product that people have bought, rather than things that are outside of this of these elements, the engagement is actually higher. One last thing, I think Peter said it implicitly. Everything has to be fully integrated. Both the two Peters said it in several places. Integration is absolutely key. So everything has to be in one place, and both the app, both the measurement, both and the rewards. And we do believe that we still have a lot to apply in terms of behavioral science. This is, I believe, it's something that in this case has to be explored and reinforced, and better understand how people are changing their behavior under which type of stimuli.
Thank you, Adriano. Thank you so much. Very, very clear. Emanuele, your last question also from your side. We have discussed about the engagement, insurers that are turning into platform business, but from your global standpoint, do you read fear or excitement from global insurers and incumbents in this global challenge?
I think there is a lot of excitement, actually. I think also what Generali has achieved with Vitality in Germany is a great sign of this mentality. But many others, without now mentioning all the different brands, but many others are investing a lot in this, either directly or partnering with external providers. I believe that in the end, all the new startups that are emerging, and there are really thousands of those around the world, from our research, more than 50% of those actually have a B2B business model, meaning they want to provide services to established players rather than competing with them for end customers. And I was looking at some figures, Simone. We had last year more than 2.2 billion of private equity and investors' money flowing into health insurance insurtechs, which is more than 25% of the total amount of investment in the sector. So I do believe that there is a clear synergy on one side, from the newcomers that can probably leverage the brand and the reach, the customer base of the established insurance companies, and also from insurance companies on the other side that can actually quickly scale those type of models, and also resist some probably intrinsic risk adversity, when it comes to investments. So they can actually test certain models and certain services in a rather easy way, partnering with external providers, and then in case the service actually picks up and takes up, then they can double down on their own investments. So there is a clear synergy, and I do believe that most of the operators are going in that direction.
Okay, thank you so much, Emanuele. Very, very interesting. Fine. So I please ask to our participants and audience to formulate some questions. And actually, you can formulate questions to all the panel or some questions in the specific. So actually, I will now try to access to the question and share with the participants. Okay.
Maybe Simone, there is a clear, there is an answer directly to me, so maybe I take that one.
Okay, thank you. Can you please read the question before?
Yes, the question is whether there are geographies that are more active than others, and why. Well, in the end, I think obviously there are countries like US where the share of private healthcare is dominating over public one, Obviously, this is a main driver for of the business opportunity for obviously innovative players to come into the game. So, of course, where we see a large private market for insurance companies, namely US, for sure. Also, Germany with the health funds is a very large market. We do see bigger, so faster innovation, especially in the use of data, which I think some of my colleagues alluded to is key. So bigger market means bigger dollars for opportunity, but also a bigger amount of data that can be used to create solutions.
Okay, thank you so much. Now a question that is going both to Peter Ohnemus, then to Peter Stockhammer. I will start from Nakadu. Peter, which kind of competences, of skills, of background in terms of people do you have in the company? Where are they coming from? What are you looking for?
So I would say that's a very good question, first of all. What makes me excited is I started programming when I was 14 years old, and is that biology and computing power is getting so close to each other. And we are seeing more and more low code, no code society. So when you look at what will be needed in the digital life and health economy going forward, are business analysts that understands the business and that understand the importance of data and underlying economic models. So far, health insurance has not been very advanced in their economic models. If you look at a typical analog health insurance company, they trade between 14 to 18 times earnings. And if you look at a digital health insurance company, they would trade at 60 times to 80 times earnings. So it just shows you that data skills, data analytics skills, and economic understanding, that's, in my eyes, very powerful. The second area is, of course, at least for Dakadu, we have a lot of people with medical background, as our health score is, absolutely medically validated and a serious score. So the combination of medicine and data, and I have 5 kids myself, and I tell them all study medical and data science, because I really believe, next to global warming, health would be the biggest challenge going forward.
Thank you, Peter. Peter Stockhammer, also in your case, which kind of background do your team have? And today, in the future, how the skill set of your Vitality is evolving?
So firstly, we are around 28 people coming from 14 different nations. So we're working in a really international environment. And then you see a large variety of people. For sure, we have finance guys, we have BAs, we have PMOs, we have guys that are dealing with marketing, user experience. So when you're asking what we are looking for sure, crucial for us is technical know-how. For sure, crucial is for us customer user experience that we're having, and clearly also when we're talking about data, to analyze this data.
Thank you, Peter. A question also for Adriano. Adriano, at the end, after what we've been discussing up to now, what we need to do as a system to further move forward digital health insurance model?
Yeah, I think Peter has, the two Peter have already given some answer when they talked about the skill set that they are looking for or that they find in their companies. And that's exactly the point. So we first need people that understand more the behavior of customer in this space, the way they use technology. So we need people that understand technology. we need to invest more in this side, understanding the customer. Normally what I've seen in the past is, okay, there is an interesting technology device, so let's attach it to an insurance product. That will not work, but it doesn't solve the problem that the client has. So we need to understand what are the problems that client have. So I read an answer from Peter about people put health above wealth. Yeah, that could be when they answer questions, but is it true? Is it true when it comes to lifestyle? For example, I think we can see that. I don't want to start a very difficult conversation, but if we look, Peter was mentioning at the beginning, most people that died of COVID had 2 or 3 different conditions. But I've seen very little, and that's my second point, very little communication, very little content, very little pushing on improve your health, and you will be better in case of a COVID infection, for example. We are looking for a remedial solution, the vaccine or cures, rather than changing our lifestyle. So it could be that some of us would put wealth below health, but changing our lifestyle, I don't know how many are actually willing to change their lifestyle in order to reach better health. But it's also little communication. So I think we need to do a lot more communication about what improves health, nutrition, mental health, sport, activity, and really make this become a very common discussion among our clients, so that they will understand that technology can help them achieve this, and insurance can help them when, for whatever reason, accidentally or unpredictably, they will become sick or get into trouble of a different kind.
Thank you so much, Adriano. So overall, we arrived to the end. Time is running out, and I would like to thank all the audience, to thank all our participants. We have been learning a lot. The market is changing. The future, as has been indicated by Peter Ohnemus, is very clear. We will go there. And as Peter Stockhammer has described, the future can be the present, as Vitality is showing full ecosystem and platform business that is running properly and efficiently. As Emanuele is saying, there is a renovated and growing energy in the direction of new digital health platform, and the awareness and quantitative activity is growing. But Adriano has, I would say, concluded in general, the consumers will make the difference, and consumers will be always more ready for a new evolved value proposition. So thank you so much to everybody. You will find, of course, this content public on the International Tech Association website and available in order to be shared with colleagues. This is very important because we want actually as many people as possible to learn what we are sharing in order to innovate and support the market in terms of evolution. Thank you again to Peter Stockhammer, Director of Generali.
Thank you so much.
Thank you, Peter. Thank you to Peter Ohnemus. Thank you so much, Peter, for your presence, your time, and your usual support. The International Tech Association, President and CEO of Decadu. Thank you to Emanuele Costa, Partner and Director of Boston Consulting Group. Thank you, Emanuele.
Thank you, Simone.
Of course, to always present and active Adriano De Matteis, Managing Director of Italy RJ.
Thank you to all.
Everybody, and see you at the next event. Have a nice evening. Bye-bye.
Bye-bye.
Bye. Thank you. Bye.
Ciao.